COVID-19. What you should know. In 2019, the novel coronavirus started affecting human beings all of a sudden. WHO declared COVID-19 outbreak a pandemic. COVID-19. Abbreviation. CO stands for corona, VI for virus, D for disease, and 19 for 2019, the year in which it first reported. COVID-19 belongs to the family of virus that includes the common cold, SARS, and MERS. But the most recent COVID-19 outbreak involves a new strain that previously had not been identified in humans. The name coronavirus derived from Latin word corona meaning crown. It's named due to its unique spike protein structure. Its spike binds the receptors and allow the COVID-19 to enter and infect cells. Mode of transmission. There was coronavirus circulating in bat, which are natural animal reservoir, and coronavirus crossover to pangolin. Thus, virus got mutated and start spreading into human beings. Mode of spread. The virus spread through airborne, that is, when the infected person sneeze or cough, the tiny droplet containing virus are released. It can reach others either due to direct or indirect contact, that is, local transmission or community transmission. Symptoms. Symptoms may appear 2 to 14 days after exposure, that is, the incubation period. The main symptoms are high temperature, cough, and breathing difficulties. How it affects the lungs. The transmission is usually via airborne droplets to the nasal mucosa. Once the virus reaches, it replicates locally in ciliary epithelium, causing cell damage. This cell damage triggers the production of inflammatory mediators, which increase nasal secretion and causes local inflammation. These response in turn stimulate sneezing. Also, the fluid accumulation in the air sac makes low oxygen intake or exchange of gas end up in difficulty in breathing. Emergency care. If you think you have been exposed and developed a fever or other symptoms, call a healthcare professional immediately. Diagnosis. Cold caused by coronavirus cannot be distinguished clinically from other cold in any one individual. The virus is difficult to isolate. So, there are tests like PCR are now being introduced. To carry out the test, nasal swab taken from the suspected person sent to process to isolate genetic material. Small pieces of specifically engineered genetic material called primers are introduced and bind to the isolated genetic material, initiating amplification. Fluorescent markers bound to the copies during PCR are released and can be detected when amplification occurs. Treatment. At present, there is no specific treatment. Basic supportive care, fluid, oxygen, ventilator support is provided. Unfortunately, no vaccines available. Prevention. Getting sick is to avoid being exposed. Avoid person-to-person transmission by wearing masks, by practicing good hygiene like regular hand washing, by disinfecting the place you have contacted with. Social distancing. This is the new protocol taken up by the high authority to break the spreading of coronavirus. Self-care. In this current situation, self-care should be our priority. So stay home, stay healthy. Presented by Dr. Shanita Robinson.